Hi there, I'm Professor Dr. Afzalunessa Binte Lutfor, Head of the Department of Microbiology at the Newszonebd Medical College of Mokbazar. Today we are going to discuss about gram-positive anaerobic bacillus and gas gangrene. We have already discussed tetanus, so today we are going to study how the gangrene occurs and what is the gas gangrene and how the organism contributes to gas gangrene. So let's see what we have got here. So here, the Clostridium group, gram-positive anaerobic bacilli, the group has got 4 species producing specific 4 kind of diseases, right? Like Clostridium tetani causes tetanus, producing a neurotoxin. Also Clostridium botulinum causing botulism by Clostridium, which is a kind of food poisoning. Then Clostridium perfringens, which causes both gas gangrene and food poisoning. There are also a number of Clostridium group that contributes to the gas gangrene, like Clostridium septicum, Clostridium edematians, Clostridium sordelli. So these all together can cause gas gangrene, which is usually a very severe case, which is usually a rapidly progressing case, and the patient can have to remove his part of the body or her part of the body. So this is important to identify the organism at the very onset of the disease. Otherwise, you are of no help to the patient. Okay. So also another species, Clostridium difficile, which causes pseudomembranous colitis. So what we have, these gram-positive large bacilli which are anaerobic and they got spores, and these spores usually larger than the bacilli. So it kind of gives a morphology like a drumstick appearance. They are motile with peritracheous flagella and they are not capsulated, except with the exception of very few species. So the virulence factor of these organisms are mainly number 1, spore, because how does spore is a virulence? Again, let me remind you, the spore, of course, it is a virulence factor. Why? Because they can remain as a spore in any adverse condition. Neither you can kill them with antibiotic, nor they can be phagocytosed, or any antiseptics, disinfectant hardly can kill them, or it requires real sterilizing methods to destroy them. So in any kind of adverse condition, they become this spore, they form sporulation and become spore and remains viable for decades, like Bacillus anthracis, So the other virulence factor of these species are the poison. Talking of poison, they have these Clostridium perfringens have both enzymes and toxins to play an important role in the producing gas gangrene. And of course they are flagellated, so they can spread very quickly. So what is gangrene? Gangrene is a localized cell death by obstructed circulation with superadded bacterial infection. So what is gas gangrene? What is gas gangrene? There is a difference between gangrene and gas gangrene. So gas gangrene is a deep wound infection where there is a destruction of the tissue, often caused by a combination of 2 or more species of Clostridium group. So there will be presence of gas giving a crepitus at the site. So Clostridial myonecrosis is the other name of the gas gangrene, and we can say that this is a severe form of infectious gangrene. They develop in deep lacerated wound or muscle tissue. Their incubation is only few hours, and they have a sudden onset characterized by severe pain, rise of temperature, and marked prostration and severe local pain. With the crepitus at the site because of the gas bubbles. Okay. Microbiology. So I've already mentioned the organism involved: Clostridium perfringens, Clostridium edematians, Clostridium septicum, Clostridium histolyticum and other anaerobes. So you know all about morphology of Clostridium. So how does this Clostridium get entry to the human host? As you all know, they are anaerobic organisms. So when they remain at in the environment, there has to be in the spore form. So spore is the infectious agent here. Do remember, don't mention a bacilli in case of anaerobic organism when it is it occurs from the environment. Okay, so the spore is the infective form, get entry to the body, then they germinate, then they multiply, then the vegetative form after multiplication produces enzymes and toxins. So with enzymes and toxins, they can produce both a local and systemic action. Locally, they cause necrosis or muscle necrosis with gas formation, and systemic, they can, there can be involved of liver, heart, like this. So in elaboration of the pathogenesis, we can explain like bacterial spore enters in the broken skin or wound. The spores, sometimes, sometimes bacteria can enter at in the anaerobic, these anaerobic bacilli we have sometimes in our, as normal flora in our gut. So that can also, from the local site to a different site can cause infection. In that case, bacteria can be involved. Otherwise, from the environment, and wound infection is contaminate with spores. The spore enters the body. The bacteria present in the circulation system, the spore will be transformed into a vegetative form only when they get an favorable environment, and that is anaerobic condition. Now this is very important to note why there will be an anaerobic condition at the environment, because if you know them, you can prevent it, right? So when there is any condition like the injury is lacerated, there is mass tissue necrosis, blood vessels are damaged, so there is very highly probable that oxygen supply is cut off, and in absence of oxygen, the spores will transform into the vegetative form, because anaerobic condition is helping them to survive. And then presence of any aerobic organism which will consume the air and helping the anaerobic to grow on. Presence of any substances that oxidize like nails, iron, or vitamin C, calcium, salt, this sort of stuff exaggerates the condition of helps in anaerobasis, leading to the vegetation of the spores. And then the bacilli multiply, and then they form both enzymes and toxin that plays role in the diseases. So the enzymes, talking of enzymes first, the enzymes, there are mainly two form of enzyme, collagenase and protease, lipase. So these collagenase, three type of enzyme actually. Collagenase breaking down collagen, lipase breaking down lipid layer of the cells, human host cell, and protease also causing proteolysis. Though, and with this enzyme, they can also have get nutrition from, so they can survive more, multiply more from the protease enzyme or the collagenase enzyme. They can have their appropriate environment getting nutrition and also producing the fermenting carbohydrate, producing acid and gas at the site. At the same time, these enzymes also will kill other host cell, other surrounding host cell, and extend the anaerobic environment, thereby extending their, their presence at the site, multiplying the, extending the tissue of the host cell, right? So these they also produce gas, hydrogen sulfide, because the hydrogen sulfide will produce by, ammonia will be produced, and destruction of protein and carbohydrate both leads to the production of gas. So there will be crepitus in the tissue, as I have already mentioned. Then what happens, there is also some toxins which are very, very damaging. The enzymes at the same time breaking down all the tissues and the whole cell, and what the toxins does, mainly 3 type of toxin: alpha, beta and enterotoxin. Alpha toxin is the prominent of all, that is phospholipase C and lecithinase. Lecithinase breaks down the lecithin layer of the host cell membrane. So they lyse RBC, platelet, leukocyte and endothelial cell as well. And there will be increased vascular permeability with massive hemolysis and bleeding type of tissue destruction. So these may lead to the hepatic and cardiac dysfunction at the same time. Beta toxin is responsible for necrotic lesion in necrotizing enterocolitis. And the enterotoxin is the part that causes the food poisoning that occurs in Clostridium perfringens. As I have already mentioned, the Clostridium perfringens causes gas gangrene and food poisoning. So enterotoxin is the cause of the food poisoning. Talking of gas gangrene, I have a picture here to show you how does it look like, because at the site of the infection you can immediately understand, yes, this is a gas gangrene. My God, you have to act immediately. You have to, because this is rapidly growing, and there is an important caution from the surgeons that when you treat or devitalize the tissue or infected tissue of the host, you must cut a healthy side, because the organisms will remain in the devitalized tissue, because the devitalized tissue is giving them the nutrition from the protein, carbohydrate and lipid, so they remain in the feeding on destructive tissues. So that part has to be cut off. So cut on the healthy side. So healthy side, by cutting them, you are getting rid of the organism. Then you treat them as well. So this is very important, to get rid of the part of leg or finger if it is gas gangrene and you cannot, because life is, it is better to save the life than the limb, right? So other infections it may cause, other than food poisoning, cause this appendicitis, internal infection inside the body cavity, necrotizing enteritis, gangrenous appendicitis, biliary tract infection, and also there can be endogenous gas gangrene or in the intra-abdominal organ. There can be brain abscess or meningitis due to these organisms. Panophthalmitis is a rare condition. They can also produce thoracic infection or urogenital infection. You can never say. The symptom, what are the symptoms will be? There will be high fever, there will be massive tissue destruction, so patient may go into the shock. Then there will be very outstanding feature causing blackening of the lesion. So there will be blackening, discoloration of the lesion and blebs or bullae or the gas. You can also do not find the blebs, but you can feel the crepitus at the side. So because of the gas, and these blisters with gas bubble will be near the infected area, and the patient heartbeat and breathing will be rapid. So prevention, as I have already mentioned a few lines about it, let me explain. First, you have to clean the wound thoroughly, avoid the contaminated material. Impaired circulation in patient with poor circulation will be helped to regain the circulation. How? Sometimes treatment with hyperbaric oxygen to treat in the gas gangrene helps. Hyperbaric oxygen will give some oxygen supply at the site, and antitoxin is another passive immunization in gas gangrene helps. So investigation, you'll have to give CBC, total count, then arterial blood gas level is very important to see, X-ray of the limb chest to exclude other things, and then CT. And of course, don't forget to do the renal function test and liver function test as well. gram stain from the wound swab, from the deep site wound, you can take and make a smear, sent to the microbiology laboratory instantly. We can fix it. After fixation, it's okay. We can then do easily gram staining, and we can identify the large gram positive bacilli with, enlarged pole, containing the spores at one pole, and usually I said it is larger than the bacilli surface area, so it is easily understood. And upcoming investigations are doing the ELISA or for exotoxin and PCR to identify the strain, that is exotoxin. I have a slide here to show you Neglege's reaction. It is also done to see the toxin, both the organism, whether it is present, whether it is to identify whether it is Clostridium perfringens. Clostridium perfringens produce lecithinase. To identify this lecithinase, we can culture on a plate, and this alpha toxin or lecithinase will break down the lipoprotein complex if we add in the medium. So the lecithinase organism will break down the lipoprotein complex in the medium, producing opacity, indicating the growth of Clostridium perfringens. This is one test we can do. Another Neglege's reaction is containing antitoxin in the medium. So at the part, half part of the culture plate will be added to the, with the addition of antitoxin, the rest part without the antitoxin. So we'll find that without the antitoxin part, the organism growth is clear. Growth will occur, and at the part where we have used the antitoxin or antisera, will neutralize the toxin if it is present or produced by the organism. This lecithinase organism will be produced on the other part, neutralizing it, giving clear-cut picture of presence of toxin there. So this is how Neglege's reaction works. What are the risk factors for the gas gangrene? The trauma or recent surgical wound, atherosclerotic people, diabetic people having colon cancer, they are highly people that fall in the category of high risk group. So we can also treat the patient of gas gangrene by giving anti-gas gangrene serum. There is anti-serum to this lecithinase antitoxin. So it will help the patient to help them to neutralize the toxin before it destroys your tissue and extends the gangrene. So I have a picture here to show you and to question you whether this picture of the leg of a patient is a condition. Is this the condition you will say that gas gangrene or not? Why not? Or why in favor of your answer? So with this note, with this question and the picture, I'm finishing today. Thank you very much for hearing me out. See you next day. Allah Hafiz. Thank you.